The arteriovenous fistula is the lifeline of a hemodialysis patient. With proper care and follow-up, the lifespan of this vascular access can be extended, preventing complications. If any issues arise, we can educate them on appropriate actions. How can we monitor their vascular access? A well-functioning AV fistula has what is called a fistula trill. A fistula trill is a vibration or buzz that indicates normal blood flow through the fistula. Patients or their family members can be educated to check for this trill. A decline in the strength of the trill or its absence indicates a problem, such as stenosis or thrombosis. So patients should monitor their AV fistula at least once a day. Some patients may find this difficult due to a lack of sensitivity in their fingertips. In that case, another way to monitor their fistula trill is by using a stethoscope. Using a stethoscope can help these patients listen to their AV fistula, avoiding unnecessary fears and potential misinterpretations. If your patient notices a change in the strength of the trill or sound, they should contact the hospital. If the trill and sound are entirely absent, they should visit the emergency department to have their AV fistula examined. Engage your patients and enhance their vascular access.